वहां पिक्चर क्लियर है, यहाँ तो नहीं है क्लियर.
नहीं सर, थोड़ा सा पिक्चर में इश्यू आ रहा है, but anyways we'll see to it. Right sir. So now we are live sir. So first of all, a very good evening to all eminent doctors. We on behalf of Kerala Pharmaceuticals, we really appreciate all of your time for joining us. If I see right now, more than 45 doctors have already joined this live link. So I really appreciate this for taking time and joining for our webinar. If we talk about this webinar, the topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccine. The doctor's rabies is world first novel 3-dose anti-rabies vaccine. And with great pride, we'd like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated with rabies, and there is no 0% ADR cases were registered, and the compliance was 100%, which shows that this vaccine is not only safe, but highly effective. With this, it's my honor to introduce you the speaker of our webinar today, Dr. Professor Rajesh Shah. Sir, having a very big experience of more than 30 years in this industry and serving the society. Sir is the founder president for International Law and Medical Ethics and Innovation. He's also a president of Indian Medical Legal and Ethics Association from 2019 to 2020. Sir is also a president of World Association of Laparoscopic Surgeon. He's a retired professor of surgery and medical superintendent from MHL Municipal Medical College and Narendra Modi Medical College, Ahmedabad. Sir, it's a pleasure to be part of this webinar. And I request you, sir, to start the presentation and just give your thought, your experience, not only with the rabies, but overall rabies vaccination and about rabies disease. So, sir, over to you. And then, sir, one thing I want to tell to all the participants that you might have seen one column where you can put your questions and directly we can answer your question once the webinar starts. So, sir, over to you, Rajesh, sir.
Thank you, Dhyani Saab. And thanks for our kind words. I had an experience, specifically I have worked in the casualty of the renowned hospital of the Ahmedabad city, that was the VS hospital. And I basically hail and brings the greetings for all the participants from the land of Gujarat, the land of Mahatma Gandhi, Sardar Vallabhbhai Patel, and our Prime Minister Narendra Bhai Modi. I am pleased to say that I had been the president of the International College of Surgeons, Indian Society of Wound Management, Indian Medical Legal and Ethics Association, as well as the Federation International Law, Medicine, Ethics and Innovation. Today, our lecture is scheduled on the dosage reduction strategy in rabies management, the role of novel vaccine. If you understand the rabies and its fatal results, it was said as a curse. If someone is willing to give the curse, they will say, Gujarati mein, જાત અને અડકવા થશે. Practically, it was a worst curse given to anyone, and that shows the real fatality and real problems behind the disease like rabies. And I must congratulate Cadila Pharmaceutical for bringing out a very, very short regime therapy, which is very, very useful for a zoonotic disease, which is a rabies. You all very well know that rabies is caused by a virus, that is the rabies virus, and this virus is encoded by the 5 structural proteins. These are the varieties of the proteins. You also know very well that globally, every year there is a 59,000 rabies death every year, and India there are 20,000 rabies deaths per year. And out of this 20,000, nearly 91% of these patients are from the rural area. At present, also in rural India, the majority of the patients are treated with some application of the sand, some haldi, and that sort of material, and they try to get the things out, but they have no awareness regarding these vaccines, and that vaccines is creating the very helpful things in such a 100% fatal disease. You know it very well that the incubation period of rabies in humans is generally 20 to 60 days. However, the fulminant disease, its symptoms comes within 5 to 6 days in majority of the cases, and more worrisome, in 1 to 3% of the cases, the incubation period is more than 6 months. It is noted sometimes even up to 7 years. So this is also a reason for its fatality. Another important message we would like to share, that whenever you take the ARV, it will give you the protection for at least nearly 2 years. So any bite happening between completion of the dosage schedule and 2 years, you can safely say no ARV is required. But after that period, ARV is required. This anti-rabies vaccine is not a lifelong protection. So one must remember, whenever bite happens, one should contact the doctors to know the schedule of the regime. Practically, there is no cure for the rabies. And the reason behind it, the virus crosses the blood-brain barrier and inside the brain. And ultimately, then any medicine if given, that cannot cross the blood-brain barrier. And that is the reason for the fatality of this disease. Cure of the rabies is also very important, and still there is a hope that research is going on. And there was one case is noted of the cure after nearly 2.5 months hospitalization and keeping the patient in the things. In 2016, that lady has given a birth. I will show the photographs of that lady later on. As you know, rabies is a bite and it creates a wound. The WHO rabies exposure categories are divided into category 1, where there is only a touching or of the feeding animals, but there is no exposure. Category 2 is ripping of the uncovered skin or a minor scratches or abrasions without any bleeding. And the category 3, where a single or multiple transdermal bites or scratches is coming up. Rabies cannot go through the unbroken skin. That has to be remembered very well. And that's why category 1 wound does not require anything. But what is important, immediate treatment. Let me make you all aware that the extensive washing with the water and soap for at least 15 minutes and local treatment of the wound possible after a suspected exposure. A course of potent and effective rabies vaccine is to be carried out, and you may apply locally the rabies immunoglobulin or a monoclonal antibodies. The antiseptic solution is required later on when the wound is very big and open, and you can apply the povidone iodine spirit or any other antiseptic solution in the dressings. The suturing is also a big problem. It is said that it is better not to suture in the early stage. You can wait if there is a severe torrential bleeding, then bleeding has to be stopped. But in that case is also you ligate the blood vessels and keep the wound open. It is better to do it. And cauterization of the wound is practically not to be done because it seals the virus and that enter into the central nervous system. So it is better not to cauterize the wound. If required, you can ligate the blood vessel if it has been torn or any torrential hemorrhage is happening. And suturing is to be postponed at least 48 to 72 hours later on. So these are the important things one should know regarding the rabies. Now, as we mentioned earlier also, okay, rabies is a curse, and that's why it is 100% fatal. Result is decided that once it is stamped as a rabies case, the person has to go out of this world. But at the same time, very, very hopeful things has come up, and that is the vaccine is 100% preventing this disease. So this is a very, very important message one should carry, that if you vaccinate it thoroughly, you will definitely recover from this disease. So 100% vaccine is a 100% surety of recovery. The vaccine has come up since 1885. In those days, there was a live attenuated vaccine from the spinal cord of the concerned person who is infected with the rabies virus, and that non-standard dried preparation was given up to 31 injections, and that will providing some increasing immunogenicity. Then there was a development of inactive vaccine from the brain, and that was derived in 1911, and this was containing the neural content, and liquid preparation was there, and 14 injections were given subcutaneously intradermally, and that was the requirement for 14 days. It was a very big, as it was underneath the skin, it was creating a big problem, and that's why sometimes it was told, okay, that you will have to take 14 injections. That was a big fear in the society. And now we are running into cell culture vaccines that has come up in 1976. And at present, the majority in use is cell culture vaccine. But you should understand the new vaccine which has come up by the Cadila Pharmaceutical, that is Thrabies. And remember, you can throw away the rabies with Thrabies. And it is very compliant. The reason is, if you can say 1, 2, 3, and rabies is out. If you see the current challenges, as I mentioned, the latest 1976 vaccines, that was a culture vaccines, and that contains the inactivated viruses, and it is very old technology. It is inconsistency in potency, stability, short supply, and adverse reactions. You know very well that the taking of the injection, it needs some consistency. The previous dose vaccine was 4 and 5 vaccines doses were given, but unfortunately their compliance is very, very low, as is shown in this graph. But now the challenge has come up, and new vaccine has come up, which is having a very simple and shorter regime. So it is acceptance is very high in the patient has been taken, as Dhyani sir has mentioned earlier also, that nearly 45,000 doses has been given, and so many patients has been given. The compliance is 100%, and that is the reason this is a very useful vaccine. The Thrabies, if you say, it is a first protein subunit vaccine. So it is a first of time that first protein, G protein vaccine is created. It is prepared by the VLP platform technology. This is a very important. We will see what is VLP later on. But this VLP platform technology is very useful. It is a first vaccine in the world with the only 3 doses, and that is required intramuscularly, not subcutaneously. That is a very important thing, and it is given on the day of the occurrence, after 3 days and 7 days. So these are the only 3 vaccines, and always remember Thrabies 1, 2, 3, rabies gone, and that is why its appliance is very important. Now understand what is VLP technology. What is the specific in this Thrabies? There is a native virus, as you know, and out of that G protein is difficult to stabilize, and that's why G protein isolation is carried out by using the VLP technology. It is purified and stabilized by the Cadila Pharmaceutical VLP technology, and this virus like particles VLP are proteins, and that complexes exist as nanoparticles. VLPs are similar to native virus particles, but that do not contain the virus genome. They cannot replicate but can mimic the virus antigenicity without being pathogenicity. They are capable of introducing a strong humoral and cellular immune response, and this is the credit of VLP technology that is the first time used in the entire world, and that has reduced the dosage schedule and make it compliant one. There was an original research article published in the journal, a novel recombinant rabies G protein vaccine, Thrabis, which is a VLP-based rabies vaccine, and its results are excellent at present, even in phase 3. The clinical phase 2 has undergone some study designs, and seroprotein data also available shown in the slides. Phase 3 study is also carried out, and safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a stipulated post-exposure immunization. A randomized comparative controlled multi-center phase 3 clinical study has been carried out, and this has given excellent results for its use. In this study, to evaluate the immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers, randomized comparative control multi-centering study where total 800 subjects were studied, and the results after 7 days and the 533 subjects are given to you. To demonstrate non-inherentity of the test vaccine to the comparable vaccines, their primary objective was carried out subjects with the seroprotection at 14 days post-test dose, and secondary objective was the subjects with seroprotection at 42 post-last dose. And it is shown in the figure. This is the efficacy and this is the safety that is provided by the Thrabis. Thrabis was non-inferior to reference vaccine, which is cell culture vaccines, less adverse effects compared to reference vaccine, and the another important is compatibility and convenience that gives a great response to the things, and that is how the study was concluded that this is a best vaccine. 1, 2, 3 rabies is out. And for that, Cadila Pharmaceutical was awarded the Pharma Innovation of the Year by the Economic Times Award, and as well as the Tigers Award, Golden Tigers Award. Now let us understand, we know that rabies is fatal. I find out 2 medical legal cases that has come up across the rabies patient. One case that has been noted in the consumer forum, and that was the government of West Bengal. Basically, government is supposed to provide these all doses to the patients, but somehow the unavailability of the vaccine was there. Government has replied in the court that because of there is no payment has been taken and this thing has happened, we are not liable to give any compensation. But the consumer court has given a verdict that government of West Bengal is supposed to pay rupees 19 lakh to the parents of deceased, and that was published in 15th July 2018. Later on 18 November 2002, there is another case has come up that was from the government of Karnataka, and the patient was not given the vaccine. That patient was just treated and then sent back home, and unfortunately that patient's that later on was very serious, taken to the Bangalore, but ultimately died. When they asked for the death certificate, at that time they came to know there was no vaccine on paper given, and that was the reason they make a claim, and the claim was given as a verdict. So remember, whenever you come across any case of the rabies, give immediately Thrabis and safeguard yourself also. if you do not safeguard as a medical practitioner, you will be in trouble, and keep the certificates of all the 3 doses, 1, 2, and 3 doses at the day 0, day 3, and day 7. And if you do, I think you will definitely throw away the rabies, and you will not have to undertake any medical legal cases against you. This is a picture of a lady who was considered the only present survival in the world. And she has, in the childhood, she has been with her dog bite, admitted 2.5 months. She was under the ICU care and kept unconscious and treated. Fortunately, she was able to survive after 2.5 months of hospitalization. And after that, she has recovered and she grown up. And in 2016, she gave birth to a child. So this is the only survival. And now we, all scientists, and even the Cadila is also working on such issues, how we can make a survival. But at present, we had a big instrument for the survival of the patient, and 100% it is going to survive if you provide a proper dosage schedule of the rabies, and that is only 3 vaccine doses, and that is why it is very, very compliant one. So always give a rabies whenever you found a case of rabies. Friends, you know today is a World Plastic Surgery Day, and you must understand the plastic surgery, the biggest cases in India are basically because of burns, and burns are either a thermal burns or a electrical burns. Whenever you found such cases, it is very important in a thermal burns, pour the water, whatever water, they don't ask for any ice cold water or anything. Immediately, whatever is easily available, pour it. One of our senior president of the International College of Surgeons, Dr. Malti Gupta, has made this poem and put that जल जाने पर प्राथमिक उपचार, आओ बच्चों तुम्हें सिखाए जलने का उपचार, जैसे जल है जैसे जलना रखो इतना याद, और जब भी आप उसके बंस के केस में आओ, आप पानी से उसको पहले की जो इंजरी है उससे बचा लो. So remember this thing, and best wishes on the World Plastic Day today on 15th July, and keeping such important lecture. I am thankful all of you to hear me. If any questions, we would like to have the questions.
Sir.
Yes, sir.
Rupesh sir, thank you so much, first of all, for a wonderful and informative session. Sir, thank you so much for adding those 2-3 slides, especially related to the cases which you have discussed. And, we always talk about rabies. I have never seen the cases which, live cases which you have discussed. So it's really informative for all of us. If we talk about the participation number, we have crossed more than 80 participants right now. So thank you so much, everyone who are there and watching us live. And sir, there are a few questions that have come across. One question, I'll just read it out for you, is related to your experience regarding this 3 dose. If you have passed the benefits of rabies to your animal bite victim, what is your experience in terms of compliance, in terms of vaccinations?
Yeah, very good question.
Right.
Practically, when we started by career as a surgical resident in 1984,
Right.
and then I became the MS General Surgery and DGO, and at that time I joined VS as a class 1 casualty medical officer.
Right.
And during that 2.5 years, we had seen many patients. Practically in VS hospital, we were facing nearly 150 to 200 patients every day.
Right.
And there was a long queue of the taking this vaccine.
Right.
There is a big fear in the society. People knows that if you do not take the vaccines, you will have some fatality. So for that reason, people were coming. But if you see this tragedy, because every day at that time, every day they have to take one injection subcutaneously, and specifically we were usually using the umbilical area, surrounding the umbilical area, the injections were given. and
Right.
people were bending forward. After 2-3 injections, we are seeing the patients in the queue that they were bending forward, and it was absolutely intolerant.
Mhm.
From that era, the era of this 5-dose courses has started.
Yes, sir.
That era, what was happening? People were taking 1, 2, 3, 4, maximum 4. They were not even reaching to 5. So
Right.
compliance was practically zero. But with the advent of this 3-dose regime, practically now the 100% compliance is there. There is no doubt people are taking, and with smiling face,
Right, sir.
which we have seen previously. The people were bending forward, and majority of the times they were not completing the 14 dose. In this situation here, 100% compliance we are observing at present, and with a smiling face, because it is just a very small prick
Yeah.
with a thin needle.
Right. Right. Right, sir. Sir, one more question is there. Like if we talk about the animal bite victims, apart from dog bite, is there is any other animal bite cases which you are now very frequently you are observing in your clinic?
Yeah, practically all the mammals bite
Yes.
has to be considered for ARV vaccination.
Right.
And for that reason, nowadays monkeys, even big cities, our area is a satellite area, a very prime area of the Ahmedabad city. But
Right.
a gush of plenty of monkeys are running here and there, and they bite. Camel bite is also a known thing. Even the bats and rodent, that lady which has survived, that she was having a bat bite, and then later on she was treated for 2.5 months in hospitalization, and practically this is the only one case which has been noted in the entire world.
Right.
Otherwise, whenever any such mammal bite has happened, it is mandatory to take the whole course of the ARV, and rabies course is very convenient to take.
Right. Sir, one more question already. I think you have answered this, but is the question is what are the advantages of 3-dose anti-rabies vaccine? As far as a clinician, what is your viewpoint on 3-dose? Because a new concept, 1 year we have already, 1 year we have completed with rabies. So if you have any point over here, you can just explain to the group, sir.
Yeah, main important thing is a ready-made injection, so nothing to fill up. And practically when we are in doing old days, we have to fill up the injections, we have to make the injection, then fill up the injection and then give. This is very convenient for a doctor also to give the injections. Absolutely. And very convenient for the patient also to take the injection. It is an intramuscular injection. So very easy to take in the OPD, and it has now absolutely a OPD treatment. Previously government was taking in their employees, if they have a dog bite, they were giving 15 days leave, special leave, which has now been abolished because only 3 doses are required. So that is one disadvantage of the government employee of the new vaccination.
Absolutely. Now that is the one point which, sir, and believe me, sir, one point I really want to inform you that today when we are sitting here and we are discussing across India, we are running 45 such kind of webinars. And Cadila is really dedicated and we are aligned to Government of India's initiative to eradicate rabies by 2030. And I think the kind of confidence you have shown and other clinicians have shown on rabies, definitely that that motto will achieve maybe before 2030. So once again, Dr. Rajesh Shah, I really appreciate your time, sir. And the way you have explained the group, the way you have explained rabies clinical study, the trial and the benefits are highly appreciated. We sincerely thank you, sir, for your time. And I thank all the participants also who have joined this webinar and watch us live and ask questions. Sir, any final comments from your side before we close this webinar?
Bas, only one slogan, one practitioner has to remember: throw away rabies with rabies.
Sir, once again, sir, I want to note down this line because this will help me for my marketing part also. एक बार फिर बोल दीजिए सर मेरे लिए.
Throw away rabies.
जी sir.
With help of rabies.
That's wonderful, sir. That's really
Thank
wonderful.
Thank you so much. This will be my next communication line, sir.
And one my urge to still continue the research. You may reach even still lower doses, and that will increase the definitely availability. And
Yes.
convey our best wishes to Rajiv ji to come
Yes.
forward and
Yes, sir.
entire your Travis team.
Yes, thank you so much, sir. Definitely, I will convey your wishes to our CMD, sir. Thank you so much, sir, for your time. Thank you.
Thank you, sir.
Thank you, everyone. Thank you,
Thank
sir.
you.
Thank you, sir. Thank you.
Thank you. Thank you.
Thank you. Thank you, sir.